excited to be here today with everyone from ALTIUS Answers. And today our special guest is Richard Mackey. Richard Mackey has a long history of experience on working in healthcare and really the artificial intelligence industry. Richard's career started with pharmaceuticals, and then he had branched into other areas. Richard, if you would mind giving us a little bit of background and just walk us through your history, and then really focus too on what drove you to become super passionate about artificial intelligence in healthcare.
Sure. Thanks for the opportunity, Stephanie. Look forward to talking to you and being here today. My background is largely within life sciences, healthcare, in supply chain, and in IT. So earlier in my career, I found that as I was working through supply chain issues, projects, opportunities, working with large global organizations, that as we were trying to get information and data together, whether it was being able to manage products and materials in our warehousing and in our operations and manufacturing activity around the world, that information and gathering that information, being able to understand it, being able to make sure that we were making the best decisions for the organization and executing on the opportunity that supply chain has. When you think of strategic sourcing on a global level, for example, the gaps in information technology were a big issue. And so it's really been over the last 15, 20 years of my career being able to get closer to the technology side of things to be able to help make supply chain practitioners more effective and be able to help them realize the value that they can bring to the organization and move from one part of the operation, the back office, to very much part of the front office strategic mission and vision of the organization. And in healthcare, I think today we see an industry that has a real opportunity when it comes to artificial intelligence, when it comes to automation. And so for me, that passion comes from the opportunity to really make a difference, not just in the healthcare industry, but in industry in general.
I absolutely love your background, especially when you're talking about supply chain and all of the different things that you have done to really elevate that operation within hospitals. A lot of times when we work with our clients, we find they don't have a system in place to help them actually capitalize on the reduction in savings that they could have by standardization, by automation. In a lot of cases, they still have very manual processes which hold them back. So I think that's a great, development that's happening right now. In the industry, Richard, starting to hear a lot about artificial intelligence and different things that are happening, not just within supply chain, but within revenue cycle solutions, within areas of coding, with physician practices, even when we're actually looking at registration processes. What do you think are the hottest areas right now when you think about artificial intelligence, the future, where everything's going? What are the hottest areas? Where are we really going to see this industry develop over the next several years?
Yeah, it's a great question. I think one of the things that's interesting to me, as I kind of alluded to just a minute ago, we always hear and experience that in healthcare we are more risk averse and we're often later to the game on some of these technologies. What's been fun to watch over the last couple of years is that healthcare has really embraced artificial intelligence technologies and use cases in a way that other industries haven't, or the rate of adoption or acceleration is there. So relative again to other industries, healthcare has really started stepping up and is putting more of their investment behind AI technologies that comparable or relative to other industries. So a couple of examples of high-level areas where you see healthcare in particular making investments. It's around things like healthcare advisors or algorithmic medicine, having the models help clinicians make better decisions about how to provide that care. There's a lot of work going on in revenue cycle, in optimization and efficiency. I think, one of the factors when you compare healthcare to other industries, cost pressures and being able to optimize the financial and the administrative side of the equation is more pressing now than it's ever been. And so whether you're large or not as large in healthcare, there's that very persistent, constant pressure. And I think you can look at AI as ways to help provide care better, ways to help better manage the organization, ways to improve the patient experience. So things like personal health assistance or finding the right channels to provide care. These are all examples of ways that provider organizations are using AI tools to help improve the patient experience, better manage cost or optimize revenue, and in general to be able to provide care more effectively with better outcomes and in a more efficient way.
And I think one of the things that we're hearing a lot about more recently is robotic process automation, so RPA. I know that's one of the areas that Intalere focuses a lot on, that you focus a lot on. Can you talk a little bit about what is RPA so that anyone listening that isn't aware of what it is understands it, and talk about how it can really apply to all the different areas that you talked about, patient satisfaction, revenue cycle, registration, and other areas as well?
Sure. So what we found is that a lot of our organizations in any business, but especially in healthcare, we have folks across the organization that are doing repetitive, manual, administrative tasks that, while they require some thought or judgment, it can be automated with the help of computers using logic and algorithms in application code, or it can also be some of these more advanced forms of machine learning or natural language processing. And so these are ways that we've started working. Simply put, robotic automation, process automation is just taking anything that any human does in your organization, and those tasks that require less complex judgment or less advanced judgment often can be automated. And so this new automation, this new robotic automation, is really just another form of software that sits in your organization, and it's helping use the other tools that you have already, whether it's your electronic health records, medical records system, if it's your ERP system, any other form of software, for example, like practice management systems or scheduling systems. And these bots, as we talk about them, can then interact with all of those tools in the same way that your administrative staff, your office manager, your clinical teams might be already interacting with these systems. And so we've used them in ways to help reduce costs for the organization. They're improving efficiencies and reducing costs on the material side. They're helping clinicians in many cases get back to the work that they enjoyed doing and the fulfilling work of their personal mission to help the organization provide and deliver care for patients and do less administrative tasks that otherwise could be handled by these bots.
I think whenever you mention bots, a lot of people tend to get threatened. They think robots and bots, it's going to be a threat to my job. It might be a threat to my staff. I don't really understand what this means to me. And as we work in workforce optimization, so we talk a lot about the fact that if you have manual processes, it's really holding you back whenever you could actually release your staff to focus on doing the activities that they should really be focused on, instead of the real drudgery and the routine and things that oftentimes can lead to employee disengagement, can lead to employee turnover. Because if you come to work and you don't like the job, you're not passionate about the job, sometimes you're not able to perform it. So if we can transition a little bit and talk about, when we think about the bots and robots, should people be threatened by them or should they embrace them? What if I'm sitting in registration and my executive says, I'm bringing in automation to help you, I'm bringing in a bot to help you? What does that mean to me, and how does that impact staff overall?
Yeah, it's a great point. It is funny in our day and world, when people think of bots, they tend to think of ominous or activities that have negative consequences. And nothing, in our experience, nothing could be further from the truth. In fact, we found that most often when we're working on projects to remove some of the drudgery or the mundane tasks that people have and replace those with these tools, that those folks that are freed up to then go do the work that they find more fulfilling and that they enjoy more, they become our biggest champions. In fact, they're most often our repeat clients. They're the ones leading the next project to say, well, we've had great success with this specific task, automating that. Let's go do this next one with the other department or this other process that we have. So we've definitely found that they appreciate being able to, as you said, be able to get back to why they got into this line of work, or to whether it's being an office manager or something in the finance team, or a clinician being able to work more directly with patients again. There's all sorts of examples that we have of that, but some of the most interesting ones are on the clinical side, where folks that were in roles like nursing or PAs or things like that, where they are able now to spend less time having to update medical records, information, or other administrative scheduling tasks that used to be maybe not a huge part of their day. So sometimes these things are tasks that require 20, 30 minutes of every day of the week, but being able to do this across a wide number of staff really amounts to a large business case overall. And just taking away sometimes 30 minutes of a day worth of work for a certain segment of the employee team has a very big dividend.
And you mentioned the phone. We hear a lot about the amount of time that people within a practice might spend on the phone trying to schedule appointments, trying to verify insurance, just doing tasks where they're stuck on hold for half of the day. Is this something that can help with insurance verification? Can that help with those areas? And is that something that could really free up time within a practice for clinicians to spend on other areas?
Yeah, it's a great example because insurance verification is one of those tasks that many of us, no matter where we are in the continuum or in the ecosystem, are at some point or another doing that. So one of the bots that we've worked with is, for example, uh, a, um, a, a bot that will help you. The patient provides their insurance card. If it's a third-party payer, the system can scan that card, go to one of the various sites that are provided by each of the respective payers, and it's smart enough to know who it is based on the images and the information on that card. It can then share that information that was presented on the card to the site, and it can bring back, if it's been approved with the information around that patient's account, it can bring back that information and store it in your billing system, ERP, EHR, whatever the case might be, based on how you're managing that within your organization. But you can imagine, all of us, no matter how big or how small, we're all at some point doing that activity. And sometimes there's an administrative component to that, sometimes a clinical component to that. And being able to have that information kind of automated and routinely provided by the bot is a great example of where that can be, be delivered across any kind of provider in the ecosystem, really.
Yeah, it seems to me that everyone should have a few bots helping them out in their job in the background.
It's true. It's really, you think about all these times today where we have to, on a regular basis, go to somebody else's website to give them some information, do some kind of a transaction, or bring information back. And all of those types of things, these bots in a lot of ways are like little ways of building integrations between our systems that we use in our organizations and all of these other companies that we work with. So, we have examples where we're using these on the HR side of the equation. We do quite a lot with payers. We do a lot with accounts payable, accounts receivable, all parts of the organization. But those are just, you can think to yourself, anytime that you're asking somebody to go to somebody else's site and kind of interact with that and bring something back to help you in your day to day, that's where we do end up using a lot of these bots.
And I think that sometimes in our industry, there's a perception, or even in any industry, that there's a perception that this might cost so much that we can't afford that. So everyone continues to do the manual processes and still take 3 hours to do something that might take 5 minutes. Can you talk a little bit about what is the typical return on investment? How much does it cost to put something like this in? And is it accessible to all hospitals, to all healthcare systems, and even small practices?
Yeah, that's a great question. And you probably know, Stephanie, because we've talked before. This is a passion. I get passionate about this because I think that when we used words like AI or machine learning or artificial intelligence, it has a tendency, when you're not as close to it or you don't get some of that information, you get a little bit scared, or you think to yourself, well, this is like an IBM type thing that's going to cost millions of dollars, and it's well more complex than what I could do with my team or my staff. And what we've really found is that with the advances in cloud computing and increases in storage and computer vision, all as those costs come down, these tools are much more affordable than what you otherwise might think. So in our experience, we've been able to work with very, very large organizations, large IDNs across the country. We're also working with regional community hospitals, rural hospitals that may have much lower bed sizes than some of the bigger players. And we find that because we're leveraging these tools and these frameworks, that we're not having to rebuild it each and every time we go from place to place. So just to help people understand, we've done projects for as little as $10,000, $15,000 in terms of a cost to implement, all the way up and to much higher numbers. But these one-time costs to develop a solution, there are some more nominal kind of management or maintenance fees that go along with that if the organization would like to leverage our services. But this kind of a model is typical for the way that we work and the way that others that are helping to deploy these bots in healthcare and other industries, very common. And so it's an important thing to share with folks, because these kinds of investments, in terms of your earlier part of your question around the return, we often find that whether it's a large, complex project or a smaller one, we're often able to deploy these bots in 6 to 8 weeks. And so we're talking weeks, not months, not years. So this is not like an EHR, EMR deployment. And as a consequence of that, we're often able to get payback for the initial investment, whether it's large or small, in always less than a year, but often, 6 to 8 months, we're able to get payback in terms of real return. And I think the other thing I'd say on the return side of it is that don't think of this as, yes, you automate labor, and so you're able to reinvest that labor back into other purposes. But really, these projects don't pay for themselves, quote unquote, based on the labor. They're more helping to increase or optimize revenue. They're more helping to materially decrease costs. And so those efficiency or those revenue gains are really the bigger components of return for these projects. And I think that's more exciting, because this is not about a back office, let's reduce headcount. And I think that it's more about how you can strategically drive your business or your operation forward. And I think that's where, when we talk with your team, you and your team, about labor optimization, that's where it starts to get very interesting, because these kinds of tools are very complementary to the types of work and the projects that you and your group help providers with.
Yeah, absolutely. It's really exciting to us as well, because not only is it the optimization of labor and really focusing on making sure that the human element can perform the functions at the highest task, but you can also focus in on the reduction of errors and the reduction of waste.
That's
Because
right.
as you look at what's happening within healthcare, there's a lot of redundancy. There are a lot of errors. There's a lot of repeat work that has to occur just to get a bill out the door accurate, or just to perform a function accurate. And the automation of AI can really help reduce those errors, and then help me as a human in my job actually perform better at a higher capacity and better output. So we're right there with you. We don't view this at all as a reduction in hour or a reduction in cost on that side. It's really a matter of helping to make everybody more effective in the role that they have. So, how can I perform my job to the best of my ability, and make sure that the time that I'm there, I'm as valuable as possible by utilizing all of these other systems and processes that can work in the background to help me perform better.
It's very well said. This is exactly right.
So if I'm a medical practice or a hospital healthcare system, I'm saying, okay, I'm going to dive in. We think that there's strong return on investment. The cost point's only $10,000 or $15,000. We know that we can do something. Where would I start? If I have no idea what I should do first, what are some of the areas that are the first places to start?
We have worked with providers across all parts of the organization. So, as I mentioned earlier, we've worked with people in finance, HR, IT, rev cycle, any part of the organization you can think of, we've done projects in. So it goes down to the fact that everybody has some IT tools or systems that they're using to do whatever their job is. And those things that are the most painstaking or administrative are great places to start. But most providers, if you look at surveys across the country in healthcare, most providers are talking about doubling their investments in automation. And it's not just on, earlier we talked about AI and how it's being used across the healthcare cycle. Many examples directly on the clinical side, diagnostic imaging, and you can think of examples like in radiology, things like that. But when I say doubling, this is on the non-clinical side. So there's quite a bit of investment happening with automation and RPA in healthcare, and it's growing at huge rates. The most common areas that we see really are revenue cycle, finance, and supply chain. Those are the three most common areas that we see over and over again. But I would say HR is an area where we're doing more and more all the time, and we really have worked across the spectrum.
Excellent. So it looks like there are a lot of different areas where an organization could jump in and really get started with the AI, Richard. So I think the opportunities are definitely there. As this progresses within healthcare, where do you see things going in the future? What's on the horizon? What are the next developments? What should we be prepared for?
Absolutely. So when we talk about AI, we talk a lot about, I think in general, what we would say is that as it relates to automation, we see that more and more of these models and tools will be helping to make more and more decisions. So we've talked a lot about examples where things are relatively straightforward. You have to look at a card. Let's go back to our earlier example. You have to look at a card and you have to decide what payer that is, and then you have to go to that site and understand how to interact with it and put information in and get information and put it back. That's all relatively straightforward, and there's not a lot of kind of abstract or complex judgment that's required there. I think in general where things are moving is that whether you're a patient, an employee, whether you're in an administrative capacity or in a clinical capacity, you'll see that these models and tools will increasingly be making more and more kind of complex judgment and thinking. So a lot of what makes machine learning unique in some of these tools and automation is that the computer is processing large amounts of data and it's learning over time how to interpret that data better and see patterns in data that we as humans maybe wouldn't always be immediately obvious to us. And so as those models and tools get better and better, and they've been trained more and more over time, they'll be able to work their way up the ladder and make more complex decisions and judgments. So I think whether you're a patient or whether you're using these tools to help provide services, you'll start to interact with them in a more sophisticated way. It'll feel more natural, and it'll be less around people having to kind of build and make changes to the model and then reset it, and it'll be doing that in a more automated way. So in the coming years, you'll see that kind of grow. I could give you one example of how the work that we're doing is advancing and things that we're interested in. We have bots, and then we've also been deploying a chatbot that will help people understand. So in our case, we do a lot with material supply chain, being able to help organizations take best advantage from the value that their third parties providing goods and services can deliver to the organization. We have a contract portfolio in our GPO business that provides different kinds of goods and services to people. So we have a chatbot now where people can interact with that chatbot to understand what kinds of products are under contract, how do those products, what kind of pricing are they looking at, what are they eligible for. All of those interactions, which historically have been provided by people, are now increasingly being provided by these chatbots. And so it's a step above search. And I think we've all used chatbots to book travel or to do other kinds of examples, and sometimes they're better than others. What's impressive and amazing to me is how quickly these interactions are becoming more natural and less like the answers coming back to you don't fit what you're looking for. And so that's what we're encouraged by. And we see being able to make tools like that available to folks at all parts of the organization. And as they become more natural, people can talk. This isn't just something that you have to type, right? This could be a conversation you have over the phone. And over time, you start to blur where the experience feels even better than what you would have gotten from a human because it's faster. It's happening, any time of the day or night that you want that. And you don't have to worry about a communication gap or problem. And so those are some things that I think are interesting in a general sense, but also specifically in our work, we've seen great advances, and we see that will be, I think, kind of an exciting part of where we can develop and deploy new services in the next couple of years too.
So I think, Richard, one of the things that you've touched upon were the developments in the future, and I get really excited when I think about automation as it applies to clinical diagnoses and work paths. We have a lot of situations now where the bots are in the background observing information in radiology or even with oncology patients, and the
Hmm.
diagnoses are going to continue to get better and better and better. So I know we've talked a lot about supply chain and revenue cycle, but can we touch upon that a little bit? I think there's just phenomenal opportunities for us to do a better job with diagnosis in the future and for clinicians to have access to all of that data.
Yeah, what's been some of the most interesting examples come from these diagnostic imaging as examples, and it covers all parts of the provider space. But the three factors that I always go back to, or that I think are important to share with people, and some of this is helpful when you look at healthcare in general. It's the fact that you can now access computing power in the cloud at a fraction of the cost if you were to buy it yourself. That's one main driver. The other main driver is the computer vision. So the computers, the models, our ability to take images, to digitize those, and then turn that into actionable information is a change that we didn't have. We didn't have that the way that we do now five or longer years ago. And then the last is storage, and that's been even longer than that. But the cost of storage and to hold on to this data where it feels like it's literally like fractions of pennies is what has really transformed our ability to make a lot of these gains possible. And so in the areas that we're talking about, oncology, radiology, all of these taking images and being able to use computers to help process and understand those images. Some of the work that's been done here is very fascinating or interesting to me, at least, and I'm sure to most people that hear about it. Without citing all of the specific studies in detail, there are a variety of reasons why humans being able to look at these images or process this data may miss certain things. And sometimes that's, in your work, sometimes that's organizational. It's around incentives that people have for how they do their job. And then sometimes, of course, it's just human error, based on volume or based on what they've been trained to look for or look at. They may not notice other data that are presenting, another issue. And so that's where the models and the tools have some fascinating results that really has an opportunity. I think it is transforming healthcare today, and I think that's why, maybe the other point that's worth mentioning is that for the first time this year, investment in AI by providers in the country has really it's really now exceeding the investment in analytics, generally speaking, across the board. So it's that combination of AI tools and technologies that help you along with your general analytics investments that are really starting to change the way that we deliver healthcare in the country.
I think you touched upon one important point there is that there's a shift where investments in some cases are going a little bit away from the analytics to the automation and to the IA right now. And we're starting to hear that as well. The other thing that I think is interesting that you touched upon is that this is really accessible to all clinicians and all hospitals. As I think you know that Altius, our mission really is focused on the rural community hospitals and hospitals of all sizes. And our mission is to keep the doors open as long as possible so that they can continue to provide services to the communities that they serve. And along those lines, a lot of times the smaller providers or the rural hospitals feel that this isn't accessible to them, that they
Mhm.
don't actually have the capital to have AI. So they feel less than, they feel as they can't actually access other tools that the larger systems have. Can you talk a little bit about how accessible this is to a small hospital or a small practice with maybe 200 employees and how it could help them?
Yeah. So, when we talked earlier about the accessibility of some of these tools, we've seen that in our own work and in our own practice. And part of the reason why we now do so much work with automation, and I talked a little bit about the natural language processing with chatbots and a lot of these tools, if you were to go hire somebody to build this from the beginning, it would be almost impossible. Or you think about in a rural setting, sometimes it's difficult to find the kind of talent you need, whether it's on the clinical or on the administrative or the technology side. It would be difficult to find that talent in a local market sometimes. And then to let's assume you had that talent in your local market. then to afford the salaries of the, the cost for people to do some of this work full time, it would certainly be, I believe, cost prohibitive for some of the organizations or the members, in our case, that we serve, similar to the profiles that you talked about, rural community hospitals, organizations that maybe a couple hundred people. By being able to tap in and work with partners, though, like in our case, Microsoft with Azure, or Amazon with AWS, tools like that, you have access then to many templates and libraries that help you to work with models and techniques that have already been developed that you can then modify for your own case. And so that's a lot of what we are doing in all of these areas, whether it's robotic process automation with some of those tools that we talked about before. It's natural language processing. As I mentioned, the chatbot is a great example where we've been able to take a standard model that, in this case, again, Microsoft has developed, but we're configuring it, customizing it for certain examples that allow us to use it in a contract management, supply management type setting. But it's also the same approach that people are taking for chatbots that help guide patients through presenting their needs and then helping them understand, are they best to go to a clinic or to an urgent care setting or to an emergency room. And so those are that's the same principles and the same types of solutions that people are using to make these solutions affordable and accessible for organizations of all sizes. And I couldn't agree or underline more. I think that's a lot of the work that we've done together in the past. Our passion, our interest is in being able to make these solutions affordable for organizations of all sizes, so that the care that is vital and critical to the success of so many communities in the country, that continues uninterrupted.
Yeah, and I think I can really access endless opportunities for chatbots. I know that I'm already starting to utilize them with services outside of healthcare, even with text messages, where the text message comes in and you respond, and then based off of your response, another text message comes in, and they continue to send those automated text messages, leading you through that sequencing of sales until ultimately you schedule the appointment, or you do not, or you move into a different product. And I can see endless opportunities in healthcare to access that. And when you're looking at the screen, the same thing can happen where the chatbot pops up. What are you looking for today? Oh, I'm looking for, orthopedic services. What are your pain points? And then from the pain points, it, guides that through. And eventually you end up with the proper provider for you based off of what your insurance actually accepts. And you probably might even be able to schedule the appointment initially through the chatbot. So I see this really evolving and changing how we interact in healthcare, and really automating our functions and what we do when we're scheduling an appointment.
It's a great example, and we worked with one of our providers and one of our members and clients. There is so much around value-based care and direct contracting rather, for payer based on certain arrangements. You touched on it. There's certain conditions and variables, like what kind of payer arrangements do you have? How are you covered? What's the procedure? Who's the physician? Right? There's all of these scenarios that providers are managing to be able to introduce some of these newer, more innovative methods of providing care that really benefits everybody. But because you're working in two different models or three different models at the same time, if you're on the management, the administrative side, trying to help a patient walk through, how do we schedule all of that? How do we get them set up for what's going to happen next? That can be very daunting. And so a lot of these tools, as you said, automation, some of these chatbot tools, we are working on examples or scenarios, just like what you mentioned. And I throw that in there because it really is, as we talk about improving the industry, reforming the industry, working toward a new way of providing better care in a more efficient way. A lot of these new models and methods are the future, but being able to introduce them into an organization that's got a certain way of working, it's not always simple to know when you go one direction versus another. And sometimes we've had examples where a patient scheduler or an administrative person has got an Excel spreadsheet with like a dozen different variables across the top, and they're trying to use that to help them say, okay, if this, then I go here, and if this, then I go there. And we end up losing opportunities because it's just too complex and complicated. And so we hope that a lot of these tools, like you rightly said, Stephanie, really this is just helping to make it simpler and easier to manage so that everybody gets the good outcome.
Yeah, you mentioned Excel spreadsheets that have like 20 different tabs and different workflows. So hopefully we can all deal a little bit less with those in the future through robotic automation.
Right.
So Richard, you shared a lot of great information. We talked about a lot of topics. Is there anything that we haven't touched upon yet that you really think it's important for our listeners to be aware of right now as it pertains to AI or automation?
I think I think the biggest thing is maybe not so much something that we haven't touched on, but just a kind of a final summary or wrap up here is that really for this can seem like a daunting task, and it can seem sometimes that it's done by bigger organizations or organizations that are trying and priding and investing in being innovators. We can all innovate, and we can innovate in any part of the organization. And it really just depends on your departmental, your organizational, your strategic goals, and from there we can find ways to implement or introduce these tools. And they really have, I think, when we talk about technology, a lot of us sometimes can just focus on the tool, and we forget that it's about the people that make things work. And so we always joke within our team that the technology is the easy part. We can make the computers do the things that they do. The hard part, and really what makes something successful or not, is around the people and how they're using it. And so we have found that we can have great success from a people side with these tools, and that those people are either the clinicians and the members of the provider organization, but they're also the patients too. And I think that's the exciting thing, that these tools and technologies can become part of how we best deliver care for patients. And it's not replacing our teams that are the clinicians. It's strengthening them. It's everything that you talked about earlier, Stephanie. It's helping them to focus on the work that they get fulfillment out of, and that is their personal calling. And it really just amplifies or multiplies their impact to the patients. And I think for me, that's the fun part. That's why I get up and I'm excited to do this work every day for that reason.
I absolutely love that, Richard. You touched upon the fact that these tools really amplify and elevate individuals and people. So it's really taking their individual skill sets and helping them amplify what they're able to deliver back to the organization and actually magnifying what they're able to do. And I think that's a fantastic way to really look at how AI can deliver in any organization and transcend what we can do in healthcare overall.
Completely agree.
So Richard, if someone's looking for artificial intelligence, they want to talk a little bit more about, what robotic process automation might do for them, how do they find you?
So I'm with Intalere, and you can always reach me at my email. It's richard.mackey, Mackey, at intalere.com. And we have a good-sized team of folks here that help to work with you if you're a member of our GPO. If you're just somebody in healthcare that's interested to learn more about automation, you can reach out to me, or to find more information at our site at intalere.com. And we'd be thrilled to talk to you about your interest.
Excellent. Well, thank you so much. We've touched upon so many exciting opportunities. The future of this technology and AI in healthcare, I think, is very fascinating. I really believe that we're going to see the chatbots and see the automation really accelerate and the development accelerate. And by 2025, the conversations we're going to be having are going to be entirely different, because the developmental trend is magnificent. So this is going to really accelerate, and I'm excited for what the future is going to bring.
Same here, Stephanie. Thanks for the opportunity to talk with you more about it, and look forward to working with you more in the future.
Excellent. Thank you very much, Richard. And thank you to everyone that listened to the ALTIUS Answers podcast. Really look forward to the next episode, and you can look for us on LinkedIn, Facebook. Talk to you soon.
Thank you for listening to the ALTIUS Answers podcast. For more information on anything you've heard today, please search for ALTIUS on LinkedIn or Facebook, or visit us at our website, www.altiushcg.com. That's www.altiushcg.com. Once again, thanks for listening. We hope to see you again in the future.